Hello everyone, I'm Anas Al Ubaidi, and this lecture or this session is with the title or is about the Emergency Medicine Scribe Certification Exam as part of Chapter 25, which is about review of emergency and urgent care scribing within Certified Medical Administrative Assistant course program by ACMSO. Introduction. The Emergency Medicine Scribe Certification exam is a critical milestone for individuals aspiring to establish themselves as skilled and professional medical scribes in the fast paced realm of emergency care. This exam is designed to assess and validate a candidate's mastery in various competencies required to excel as a scribe in emergency medicine settings, from accurately documenting patient encounters to understanding the intricacies of medical terminology and emergency workflows. The certification ensures that scribes meet the high standards essential for supporting providers or clinicians in acute care environments. Emergency medicine scribes play a vital role in improving the efficiency and accuracy of healthcare delivery by seamlessly managing documentation during patient encounters. Scribes enable physicians or clinicians in general to focus on patient care, leading to reduced provider burnout and enhanced clinical outcomes. To excel in procedures, legal documentation standards, and medical billing codes, the certification exam evaluates these skills, providing a benchmark that distinguishes qualified scribes as adept professionals capable of thriving in high pressure and unpredictable settings. Certification is more than just a credential, it serves as a testament to a scribe's dedication, professionalism, and ability to meet stringent industry standards. Being certified not only enhances professional credibility but also paves the way for career advancement in competitive healthcare landscapes. Emergency departments prioritize certified scribes as they bring a heightened sense of reliability and competence. Whether it's documenting critical cases, collaborating within interdisciplinary teams, or adhering to compliance and medical legal protocols, the Emergency Medicine Scribe Certification exam encompasses a broad range of topics. It tests expertise in medical terminology, ensuring scribes can accurately record complex diagnosis procedures and treatments. It emphasizes documentation standards, ensuring candidates understand how to create clear, detailed, and legally compliant patient records. Additionally, proficiency in emergency medicine protocols is assessed, requiring knowledge of common acute conditions, life-saving procedures, medication administration, and patient follow-up procedures or processes. The exam's design ensures that candidates are well prepared to contribute effectively to emergency care teams, even under the pressure of critical situations. Preparing for this certification exam is an essential step for all scribes working or planning to work in emergency medicine. It enhances their ability to anticipate provider needs, manage workflows efficiently, and ensure the seamless documentation of patient care from admission to discharge. Key points. Master of medical terminology. An in-depth understanding of medical terminology is a foundational skill assessed in the Emergency Medicine Scribe Certification exam. Scribes must accurately interpret and document clinical terms to ensure that patient records are clear, precise, and actionable for providers, clinicians, and legal documentation. Medical diagnoses, definition, familiarity with terms used to describe various conditions and illnesses. as for example recognizing acute MI or acute myocardial infarction as a heart attack. Importance accurate documentation of diagnosis prevents errors in patient care and billing, anatomical terms, understanding knowledge of a human anatomy to pinpoint locations and pathologies. Example, documenting pain in the epigastric region instead of stomach pain. Significance proper anatomical descriptions guide accurate diagnostics and treatments. And here's a summarized diagram on mastering medical terminology for accurate patient care, as we have definition, example, and importance. Abbreviations and acronyms. Requirement familiarity with commonly used medical abbreviations, example, knowing acronyms like NPO, nothing by mouth, or STAT, stat, means immediate. Relevance ensures efficiency in documentation without sacrificing clarity. Pharmacological knowledge, insight understanding medications documented during emergency care. Example, differentiating between analgesics, pain relief, and antipyretics, fever reduction. Clinical value supports safe and effective documentation of drug administration. Medical abbreviations, we have requirement, example, and relevance. As here, we have a diagram summarizing the medical abbreviations. Adherence to documentation standards. Creating accurate, thorough, and legally compliant records is critical for scribes in emergency medicine. Documentation not only upholds medical and legal standards, but also aids in continuity of care. We'll start with accuracy in charting. Detail here ensuring every recorded detail reflects the patient encounter accurately. Example including critical information such as onset of symptoms for a stroke patient. Significance reduces the risk of medical errors and ensures effective patient handoff. Clarity in organization methodology, structuring notes to ensure logical flow and readability. Example using SOAP, SOAP, which is a short for subjective objective assessment plan for simplicity. Impact here provides clarity for providers or clinicians and allied healthcare teams. Compliance with legal standards requirement following healthcare regulations like HIPAA for confidentiality, example using anonymized identifiers during teaching or research. Benefit here protects patient privacy and ensures adherence to medical legal norms. Error minimization action double checking entries for completeness and accuracy, example verifying medication doses and dates in records. Outcome here prevents claim denials and miscommunication. Proficiency in emergency medicine protocols. Scribes must be well versed in the processes and workflows unique to emergency medicine to effectively support high pressure situations. Acute conditions documentation focus here. Familiarity with common complaints and emergencies. Example, recording chest pain with arm radiation for potential myocardial infarction (MI). Relevance ensures swift, focused action for critical conditions. Documented life-saving interventions, details required, capturing procedures like intubation or defibrillation accurately. Example, recording shock delivered at 200 joule or 200 J for ventricular fibrillation for VFib. Benefit here provides legal and clinical support for interventions. Medication administration details consistency, accurately noting medications given during emergencies. Example, administered zero point 0.4 or zero point 0.4 milligram mg nitroglycerin sublingually under the tongue for chest pain relief. Purpose here ensures compliance and eliminates dosing errors. Patient discharge notes. Clarity documenting follow-up actions and patient education. Example, follow-up in 48 hours for wound dressing change. Clinical impact reduces readmission rates and ensures care after discharge. Exam preparation strategies. Succeeding in the emergency medicine scribe certification exam requires a structured study plan and a focus on key competencies. Here we'll start with developing a study schedule, planning allocate dedicated time slots for different topics, ensuring thorough preparation, example reviewing medical terminology for 1 hour daily, focusing on unfamiliar terms. Advantage here reduces last minute cramming and stress. Utilizing practice exams purpose to familiarize yourself with exam format and commonly tested topics. Example, completing mock tests that include questions on emergency protocols and abbreviations. Outcome builds confidence and highlights areas needing improvement. Learning resources advise leverage textbooks, online courses, and peer study groups. Example, using scribe manuals for reference on the latest EHR electronic health record practices. Benefit enhances understanding and provides diverse perspectives on exam content. Time management skills focus practicing time scenarios to simulate exam pressure. Example, documenting a sample HPI, history of present illness, and chief complaint within a set time frame. Utility improves efficiency in navigating real life and testing situations. Summary tables. We have here a table on key medical terminology areas, area description, example, importance, common mistake. Areas we have diagnostic terms, anatomical terms, abbreviations, medications, and emergency acronyms. Table on documentation standards and best practices. Area description, example, benefit, consequence of neglect. Areas we have accuracy, organization, legal compliance, error checking, and complete records. Table on emergency medicine protocols, protocol description, example, application, risk of non-adherence. Protocols, we have acute condition management, life-saving interventions, triage documentation, medication reporting, and follow-up instructions. Table on common challenges in the certification exam, challenge description, impact, strategy to overcome, and example solution. Challenges, we have time pressure, medical terminology, EHR familiarity, memorization of protocols, and test and anxiety. Table on exam preparation resources, resource description, example, benefit, limitation. Resources, we have scribe manuals, practice exams, study groups, online resources, and flashcards. Next, we will revise what we have covered through this lecture via some MCQs or multiple choice questions. Question 1. Which of the following best describes the importance of medical terminology in emergency medicine scribe certification exam? A. It allows scribes to communicate casually with patients. B. It ensures accurate and precise documentation for clinical encounters. C. It reduces the need for standardized documentation practices. Or D. It focuses solely on creating shorter patient records. Definitely the answer is B, as it ensures accurate and precise documentation of clinical encounters, as understanding medical terminology is essential for creating accurate, clear, and legally compliant documentation that supports effective patient care and continuity. Question 2. What is the purpose of using SOAP format in emergency medicine documentation? A. To reduce the amount of written content. B. To organize patient records into a standardized and logical structure. C. To prioritize procedural interventions over patient history. Or D. To eliminate subjective observations in patient records. Definitely the answer is B, as to organize patient records into a standardized and logical structure, as the SOAP format, subjective, objective, assessment, and plan, helps scribes create readable, structured, and organized records, which assist in clear communication and continuity of care. Question 3. Which of the following examples demonstrates appropriate documentation for life-saving intervention? A. Patient was treated for pain with acetaminophen. B. Shock delivered at 200 joules for ventricular fibrillation. C. The provider gave patients instructions for medication use. Or D. The patient presents with a history of minor injuries. The only one that is applicable here is B. Shock delivered at 200 joules for ventricular fibrillation, as documenting specific details of life-saving procedures such as defibrillation or intubation is critical for accuracy, accountability, and legal compliance in emergency medical records. Question 4. What is the best approach to preparing for the time-limited emergency medicine scribe certification exam? A. Focus only on medical abbreviations for efficiency. B. Skip difficult sections during the exam to save time. C. Practice mock exams to build confidence and time management skills. Or D. Avoid creating a study schedule and rely on last-minute preparation. So definitely C here. Practice mock exams to build confidence and time management skills, as mock exams allow candidates to familiarize themselves with the question formats and identify weak areas and practice effective time management strategies, improving overall performance. Question 5. Why is documenting follow-up instructions critical in emergency medicine notes? A. To highlight the use of an EHR during patient encounters. B. To ensure patients understand care plans after discharge, reducing readmissions. C. To create shorter standardized records for quicker processing. Or D. To focus only on the patient's initial symptoms and complaints. The answer is B here, as to ensure patients understand care plans after discharge, reducing readmissions. As follow-up instructions are vital to ensuring patients know how to manage their health post-discharge, which helps prevent complications, improves outcomes, and decreases the likelihood of returning to the emergency department. And here we come to the end of this lecture. Thank you very much and goodbye.